Back in session today, Republican leaders bringing to the floor to repeal and replace legislation on health care. Joining us this morning, Congressman John Shimkus is a member of the Health Committee, and Congresswoman Schwartz is the co-chair of the Health Care Task Force. Welcome to both of you. Good morning.
Good morning.
Congressman,
Good morning.
How much momentum is there for this in the House, and what do House members say about the fact that once it goes to the Senate, it's unlikely to get much support there?
Well, I taught civics in high school. How a bill becomes a law is, a bill passes one chamber, the other chamber passes a bill. If there's a difference, they go to conference. So we've got 87 new Republican members of Congress, including many of us who ran on repealing this health care law, and that's an obligation to the people who sent us to Washington.
Congresswoman, how do Democrats? I guess you sort of fight it in the court of public opinion once again, right?
Well, understand that this is a law. The provisions of the health care law that we passed last year, that again is now law, is already helping millions of American businesses and individuals who are calling my office, and I'm sure calling other members of Congress' office, saying, we like these provisions, please keep them. It's made a difference in the lives of myself and my families, from seniors to children with pre-existing conditions, to small businesses getting tax credits, that helping them pay for those health benefits for employees. The action that the Republicans plan for today and tomorrow will repeal all of those provisions that protect Americans right now, today, and really don't have a plan to replace it. They just want to have hearings and oversight, and I think instead what they ought to be doing is working with us to make sure that this law works the way we expect it to, and helps grow this economy and helps protect Americans to be able to get the health care they need.
Congressman, some say that President poll numbers are getting a little bit better. He got strong reviews for his speech in Tucson, and that somehow that means the GOP's got a little more of an uphill battle on this. Is that true?
Well, I think we're going to continue to have hearings on the health care. Look, if you support $500 billion in cuts to Medicare, if you support $500 billion in increased taxation, if you support a health care plan that has 10 years of revenue for 6 years of benefits, then vote against the repeal. I mean, this bill is disastrous, and that's what we all ran on. That was the court of public opinion, and we'll fight this for the next 2 years in the court of public opinion, because the public understands that this is bigger government, less benefits. Most insurance renegotiations are now going back to the employees and saying, hey, guess what? You got higher premiums and you got less benefits. That's the result of this health care law.
Do Republicans need to offer an alternative, or is repeal enough?
Oh, no. We're going to do the repeal, and that'll be voted on and out of the House on Wednesday. But then we'll go and do the aggressive oversight over the 1099 provision, which is very egregious to small business.
But I guess my question is, once it's repealed, let's say, how do Republicans go about promising the number of uninsured in this country goes down and not up?
Well, we believe in market-based solutions to bring a competitive market process, not a centralized control, demand and control system out of Washington. That's the two differences between the two parties. They want all solutions and problems solved by big government out of Washington. We want to empower the business to be able to create packages which benefit them and their employees.
Congresswoman